right? So a very nice saying I would like to quote here is, for good ideas and true innovation, you need human interaction, conflict, argument, and debate. And that is why we have the debate here today. The first debate is going to be on the carbon footprint in OR. That is, we need to reuse and recycle, will be spoken by Dr. Madhu Uddaraju. Dr. Madhu Uddaraju is a director of Sri Kiran Eye Institute in Kakinada. He's a cornea and refractive surgeon trained at Arvind Eye Institute and medical director of Balakrishna Center of Eye Donation and Eye Foundation. So with this, we have his opponent, a fierceful opponent who is very well known now because of his life beyond ophthalmology. He has been conducting it very well. He is the member ARC of North Zone, Chairman Scientific Committee of Rajasthan Ophthalmic Society, and Director for Rawat and Eye and Phaco Surgery and Jaipur Laser Vision Center. So we'll go with our first topic, which is a very important topic. So why we have chosen this is, we all know that destruction of the environment is one of the most significant challenges of our century, and medical industry plays no small role. In fact, in a study done in United States, healthcare sector is responsible for 10% of the country's total greenhouse gas emissions, 10% of its smog formation, and 9% of its ozone depletion. And even in a study done in United Kingdom, says that performing the surgery, that is one phaco surgery, is equivalent of driving an automobile for nearly 400 miles. So let us see whether we need to go with the reusable and recyclable, or it is just sterility is utmost importance and disposable is the way to go. So I now call upon our first speaker on the debate, Dr. Madhu Uddaraju, to speak for reusable and recyclable. Dr. Madhu. Madhu, your time starts now. 6 minutes.
Yes, sir. A very good evening to all of you. I firstly thank ISMICS and especially Srinivas Joshi sir for giving me this golden opportunity. And I think if our next generation has to look at scenes like this, we all need to be aware of our carbon footprint, and there is no other way but to reuse and recycle. So the scope of this talk would be under the following headings: how we felt inspired to do this study, why we need to do it, a small review of literature, we'll share our experience and how we changed after knowing the impact. So the inspiration, of course, is our alma mater, Arvind. You know that recycling and reusing and being cost effective is in the DNA of Arvind. Being trained there, we were all very used to doing this kind of practices. However, it was Dr. D.S. Morris from Cardiff Hospital from the London who did his first study on carbon footprint in 2013, and followed by Dr. Venkatesh from Arvind Pondicherry and Cassandra, who compared the carbon footprint of cataract surgery from India to the Western world. So why we need to be more aware? We all know that cataract surgery is the most commonly performed surgery in the world. And as Srinivas sir was telling, when we did our study, doing one phaco surgery in India was almost driving a car for 45 kilometers, and doing one SICS surgery was driving a car for around 16 kilometers. So this was the first study done in London, where the average cataract surgery produced a waste of 181 kilograms of carbon dioxide. And this study was done in 2011 with nearly 2,000 phacos done in that center. And the total waste produced was 405 tons in the total emissions. And these were the later studies done by Dr. Venkatesh sir and Cassandra that I was speaking about. And here what Srinivas sir was mentioning, so it was almost in UK, if you had to do a cataract surgery, it's equivalent to driving a car for 500 kilometers. Whereas in Arvind or most of our hospitals, it would be equivalent to 25 to 30 kilometers because of our efficiency. So inspired by this, we wanted to evaluate our annual carbon footprint of cataracts in our institute. So in 2017, we performed around 10,342 surgeries. So using online calculators and taking cues from previous studies, we did the calculation. So what we found out was each FACO produced a waste of 365 grams, producing 9 kilograms of carbon dioxide, whereas each SICS produced 150 grams of waste, producing 3.2 kilos. So total our surgical emissions were equivalent to 55.3 tons. And the interesting point to note was FACO surgery was 2.5, produced 2.5 times more waste when compared to SICS. And in the electricity emissions, again, FACO machine consumed around 11 tons. And the general air conditioning, if it's a single room, it was 3.4. It was daycare, it was 5.5, but the numbers vary. In single room, only 662 patients stayed, but they consumed 3.4 tons. Whereas in a sharing room, which we did major of our surgeries, that is nearly 4,000, only 5.1 ton was emitted. And common electrical appliances were around 15.5 tons. And again, coming to the paid cases or FACO cases, the transport emissions by the patients were nearly 20 tons. Similar number of patients in campsites as they were transported in a single bus to and fro, it was only 1/4. Only 5.2 tons of carbon dioxide was emitted in SICS cases. So totally, our emission as a hospital for doing cataract surgery, excluding procurement carbon dioxide emissions, was 106.8 tons. And we attributed to 0.16% of the total carbon footprint of our state, Andhra Pradesh, in 2017. A single eye hospital doing a single type of surgery. So then you can imagine the total number of cataracts that are being done in India and the carbon footprint that we'll be producing cumulatively. So what are the changes we made? So first of all, we tried to go back to our good old reusable gowns. So in that, we were able to reduce the waste by 5.4 tons and reduced by nearly 30 lakhs. Even if you include the Dobie cost, the electrical cost, and even if you had to buy an industrial grade washing machine and everything, still you would be saving around 25 lakhs per year if you are doing 10,000 cases in an annum. And the next part was the brolly drape, the head drape, the eye towel, and the packings that were being used in the sterilization. Here again, we reduced our waste almost by 14 tons, and we could save around 7 lakhs with this intervention. And coming to FACO, here we have several kind of FACO machines where you have to dispose your cassettes, or you can use a reusable cassette. So if it's a disposable cassette, the total amount of waste produced was 75 kilos. And when you compare it with a machine that has recyclable cassettes, the waste is only 1.8 kilos. So that's a huge difference. And that's why if you are going to plan for multiple FACOs, especially in a high volume setup, you need to balance and have both kind where you need not depend entirely on disposable cassettes. And coming to the blade handles, this was the most useless thing we were doing, because this handle, the plastic handles we were using were like some cheap pens or ballpoint pens we were using. But we went back to our old, this metal objects where you can just, metal handles where you can just dispose of and reattach the tips. So this was having a good heavy feel, and it had a very classical feel to it. And with this also, we could reduce the wastage by 7 tons, and we could save around 4 lakhs by introducing this old things that we were already doing. And I know that sterility is very, very important. So we compared our sterility rates after we did this intervention. In 2017, our end-off rate was 0.07. And in 2018, it was 0.03. However, there is a confounding factor here. After the Arvind study, we gave uniformly intracameral moxie in all our cases in 2018. So that could be one confounding factor where the end-off rate could be low. But still, we were doing good when we were using reusables. So I think as a team, we need to communicate with the industry about compact packing, unnecessary papers, and also ask them to promote reusable and sustainable consumables. So my take-home message is we need to adopt a balanced approach without compromising on the sterility principles. And finally, one tree can absorb 21 kilos of carbon dioxide per year. That's approximately equal to 1 cataract surgery. counseling, if we can counsel our patients to plant one tree after cataract surgery, it will make them carbon neutral. Thank you for the opportunity, sir.
Thank you, Dr. Madhu.